Okay, we are going to get this out of the way right at the beginning. Vagina. Yeah, I am going to talk today about the menopausal vagina. But I am also going to talk today about what creates a great quality of life during menopause and how you or someone you love can get it. There are two things that predict a great quality of life for all adults across all ages, 18 to 80, across the entire gender spectrum. Those two things are good sleep and good sex. I'm a professor of obstetrics and gynecology at Oregon Health and Sciences University, and I direct the Menopause and Sexual Medicine program in our Center for Women's Health. And I can tell you that my patients struggle with both of those things. They struggle with sleep, and they struggle with sex. So here I am. I must say the word vagina 25 times a day. But I'm a gynecologist, right? You guys are not in that headspace. And you probably don't say the word vagina once a day. You probably don't say it once a year. And you've been sitting here all day listening to these big ideas, and now we're going to talk about the vagina? So it might feel a little weird. I get that. But we are not going to let embarrassment keep us from talking about something that is so important to our quality of life. So stay with me here. It's just 12 minutes. And if you have to at the end, you can run screaming out the back. It's okay. But if you stay with me, this information might change your life. Because you are either going to go into menopause and go through it, or you're going to love somebody who does, if you're lucky. So here we go. So what are those two things that predict a great quality of life? Right, good sleep and good sex. Exactly. So why is that hard for menopausal women? Well, first of all, menopause means your periods have stopped. And for most women, that happens around age 50. And the reason that happens is because our estrogen levels decline. Estrogen is this circulating female hormone that we all have. And when the levels decline, it leads to a whole bunch of symptoms. So it leads to hot flushes, night sweats, lack of libido, sleep disturbance, mood disturbance. And if that weren't bad enough, the vagina loves estrogen. So when estrogen levels decline, the vagina gets less stretchy and less moist and less flexible, and those changes can lead to pain with sex. And it's totally sane not to want to do something that hurts, right? Well, the good news is that all of those symptoms are treatable, and no woman should suffer during her menopausal transition or afterwards. In fact, those can be the best years of her life, filled with menopausal zest, if her body doesn't get in her way. So we're going to break it down. We're going to talk about sleep, and then we're going to talk about sex. So I'm going to introduce you to a patient of mine. I'm going to call her Jen. So Jen was at her wit's end. During menopause, she could not sleep. She was waking up in a pool of sweat multiple times a night. She was tired. She had brain fog when she was trying to work, and she was irritable. And when her partner tried to have sex with her, she wanted to punch them because it just felt like one more demand. And when you're exhausted, the last thing you want is one more demand. So I said to Jen, okay, first things first, we are going to get you a good night's sleep. I'm going to write you a prescription for estrogen, and it's going to take your night sweats and hot flushes away in about 3 weeks. And Jen said, Dr. Adams, I don't want to take estrogen, because doesn't that cause breast cancer? And I said to Jen, what I'm saying to all of you right now, the risk of breast cancer is greater with a sedentary lifestyle or alcohol intake or obesity than it is with estrogen. The risk of breast cancer with estrogen is minuscule compared to the risk related to all these other things that we have so much control over. So take it. You'll feel better in about 3 weeks. You can use a pill, you can use a patch on your skin, you can put gel on your arm. Any of these methods are going to work. If your provider won't give it to you, I want you to go to this website. It's the North American Menopause Society, and you can put in your zip code, and a whole bunch of certified menopause practitioners will come up in your area. So see somebody who's more up to date, who knows what's going on, and will give you estrogen. It will make such a difference. So I wrote a prescription for Jen for estrogen, and then we talked about the other things that she can do to get a decent night's sleep. So turn down the thermostat. Get all the screens out of the bedroom. The bedroom is for sleep and for sex. So no TV, no iPad, no iPhone. Turn your glowing digital clock to the wall, or better yet, get one of those old-fashioned clocks with the hands on them, and get blackout curtains. What you're creating is this cool, dark sanctuary for sleep and for sex. Get up at the same time every day. I don't care if it's a holiday, I don't care if it's a weekend, I don't care how badly you slept the night before, get up. We are retraining your brain. And then don't go to bed at night until you are sleepy, until you can't keep your eyes open. If that's midnight, that's when you go to bed. And don't say, oh, I had the worst night last night, I'm going to go to bed at 9 o'clock and get caught up, because you'll fall asleep. You'll fall asleep, but you'll wake up at 2 o'clock in the morning, and then there you'll be again. So get up at the same time every day. Don't go to bed until you're sleepy. And then if you've been lying there for 20 to 30 minutes and you cannot go to sleep, get up. And Jen said, where do I go? And I said, you made a nest on the couch in the living room before you went to bed. It's got a fuzzy blanket, it's got your reading glasses, it's got a puzzle or a book. No screens. Because if you turn on your iPhone, that light is going to hit your brain, and it's going to tell your brain it's time to wake up. So you stay in your fuzzy nest until you get sleepy, and then you go back to bed. The bed is for sleep and for sex, and we're training your brain. So Jen hates me at this point. She hates me, but she's desperate, right? So she's like, okay, I'll try it. So here we go. A month later, she's taking her estrogen, so her night sweats are gone. She's doing that awful sleep regimen. People hate that, but it works. And it's starting to work, and she's starting to get some sleep, and she's starting to feel better. So she tries to have sex, and ouch, ouch. 50% of women will have pain with sex when they get through menopause. 50%, think about that. For every 2 women in this room, 1 out of every 2 is going to start having pain when she goes through menopause with sex. And of those women, only 1 in 20 are treated. That is a tragedy, and that is not your new normal. I don't want you saying, well, those were good years, but I guess that's gone. No, 50 is too young to stop having sex. So remember, the vagina loves estrogen. And what happens to estrogen in menopause? It goes down. So, and the pill or the patch or the gel that you're using may not be enough to keep your vagina happy. So that's where estrogen cream comes in. You put a little estrogen cream on your fingertip and you rub it into the opening of the vagina every night for a while until your vagina remembers it's supposed to stretch. And it will. The other things to remember that are helpful are moisturizers and lubricants. Moisturizers are things that you can buy over the counter or online. They're not a prescription, and they're not supposed to be used when you're having sex. You use them at other times to make the vagina plumper and more moist. So 3 times a week, you get out of the shower, you moisturize your face, you moisturize your body, you moisturize your vagina. Lubricants with sex are also very important. And if you need them now, it doesn't mean you're a dried up old lady, okay? You know, if you never needed it before, okay, great, you're a rock star, that's great. But 60% of 20-year-olds use lubricant, so use it. You really want to avoid any tissue trauma. You don't want any kind of rug burns or tearing or any kind of micro trauma. You want everything to be very happy. And so my favorite lubricant is coconut oil. It's totally cheap, it smells great, it's naturally antifungal, so it will tend to keep down yeast infections. It stays where you put it. It doesn't absorb into your body the way a water-based lubricant will. And it's very, very slippery. Okay, so fast forward about 12 weeks. So Jen has been using her vaginal estrogen cream. She's been using a lubricant, her coconut oil, and she found a moisturizer that she likes. So she comes back to the office and she says, "Oh my gosh, Dr. Adams, it doesn't hurt anymore. But I'm still not really interested. I wish I wanted it." And she's so sad about that, and she feels terrible. And she talks about how much she loves her partner and how she really wishes she wanted it. So we talked about libido. It's helpful to understand that most women exist in a state of sexual neutrality, meaning that we are not thinking about sex. We're not going, "Oh, I hope I can find somebody to have sex with today. Oh, I hope I have sex today." No, we're not. No, we're not. We're not. Now, at the beginning of a relationship, yes. Both men and women think about sex a lot at the beginning of a relationship. We're like, "Oh, I have that date tonight. I wonder if we're going to have sex. Maybe I should go buy some new underwear." And so we're thinking about it. We're putting energy toward it, and it's lovely. It's kind of a state of enchantment. It's why we fall in love. It's wonderful, but it doesn't last. And it's a good thing it doesn't last. Otherwise, nobody would fly airplanes or run for president or write a book or anything. Everybody would just be home in bed having sex all the time. So maybe that wouldn't be bad. I don't know. So it's helpful to understand that our libidos naturally settle down with time. They just do. It's also helpful to understand that a healthy sex life takes time and attention, and our time is the most valuable thing we have. And so it's really easy to let our sex lives take a back seat to all these things that we think are so important and are just clamoring for our attention. So I said to Jen, I don't know about your relationship and about your life, but I wonder if you had 6 weeks in Bora Bora and everything at home was taken care of, and you and your partner go to Bora Bora for 6 weeks, and the first 2 weeks you just sleep, you just catch up on your sleep. And then you have some lovely dinners and some walks on the beach. I don't know, but I wonder if maybe you might feel more like having sex. My point is not that we all need to go to Bora Bora for 6 weeks to jumpstart our sex lives. I mean, that would be great, but that's not going to happen. No, my point is that women who don't want sex are not broken. We so often feel like there's something wrong with us, something that needs fixing, instead of thinking that there could be reasons out here. So I said to Jen, you're not broken. And she started to cry. I can't tell you how many women cry when we talk about this. So we talked about the stressors in her life, and we talked about what she might do to address those. I want any woman in this room or any woman who's watching online who doesn't want sex to stop feeling guilty about it. You are not broken. And please stop saying you want your sex life back for your partner. Oh, they're so great. I love them so much. I wish I wanted it. It would make them so happy. Stop it. Stop it. You want your sex drive for yourself because it makes a great quality of life for you. Start thinking about who you are and what you need rather than feeling guilty about what you're not giving to someone else. Guilt is not a sexy emotion. It will not get you where you want to go. Start thinking about what's going on out here and connect those dots and see if that doesn't make a difference for you. Remember those two things that more than anything universally predict a great quality of life for all of us: good sleep and good sex. No, they are not superficial. Yes, they are important. Yes, you can have them. And yes, you deserve them. I'm giving this talk today because I want midlife women and the people who love them to feel hopeful. I want you to know and to believe with all your heart that the second half of your life can be the best yet, filled with menopausal zest. It takes work, but that amazing life is out there waiting for you. For you, and then for the people you love and the people who love you. Thank you.